Hi, welcome to Facebook Live. This is Dr. Annette Mercatante. I'm the health officer of Clair County Health Department, and we have our special guest today. And we have Justin. Please go ahead and introduce yourself.
Hi, I'm Justin Westmiller. I'm the Director for Homeland Security and Emergency Management here in Clair County. And Doctor?
And I am Lee Bacheldor, the Chief Medical Officer for Ascension River District Hospital down in East China.
So we're here today to answer your questions. We're going to start out like we always do with a brief review of the data up to date this week, and then we'd like to hear from you. Ask us what's on your mind or concerns that you have. So for the data today, we have our usual status report. As of the 9th, we have 602 total cases, cumulative, 128 that have been hospitalized, 52 deaths. And the vast majority of course, people who've recovered. The changes is that we still have about 4.6, about between 3 and 5 new cases per day on the average, which again is about what it was last week, but much higher than it was a few weeks ago. So we've come up and we've kind of stayed up at that new level, which is good news. We have about 155 average testings per day, and our percent positives remain low, under 3%, 2.2%, which again is very good news. Let's do the next slide. This is the one I want all of you to pay the most attention to. I keep talking about how trends are more important than day-to-day cases, because day-to-day cases can change a lot based on how we test, the results that come in, whether there's delays, etc. So the average cases really give you a better idea. Again, a large spike at the beginning in March with the reduction. The second spike is in our nursing homes primarily, and then we came down very nicely, and then we started coming up again. But you can see that second peak is not as steep and as rapid as the first one. So in some respects, I consider this good news, but of course we have to approach this very cautiously. If the cat gets out of the bag and starts going very quickly, we can get into trouble very quickly. But so far we're seeing an elevation at a very slow rate with some steadiness in the last week. So that's good news. And again, not a lot of long-term care facility or congregate care problems. In fact, all of our nursing homes are doing very well so far. Then we have just our overall testing capacity. You can see that we're holding on at about 150 to 170 tests per day. It'd be nice if we got that up a little bit more, but quite honestly, I believe that we are meeting the demands. We're able to get everybody in that's looking for testing, and our percent positivity, as I mentioned, remains low. And then finally, our dashboard, and you can see our dashboard is adjusted every single day. Go to our website, www.health.co. Did I get that right? scchealth.co, and you'll see the updates every day. So that's our update for data today, and let's get to your questions. Who wants to start?
Our first question is from Facebook. Did Governor Whitmer already speak today?
Yes, Governor Whitmer spoke at 11:30 this morning, and in her overarching message, she had a couple, but the biggest one was the state as a whole is trending the wrong way in cases, and she's asking everybody to do a lot of those protective measures that we talk about over and over, things like wear your mask whenever you go outdoors, whenever you're indoors, whenever you're near people that are not in your family, and stay away from people outside. Use that 6 feet of distance. Just do whatever you can to protect yourselves from this disease. Doc, anything on that?
Well, I'm just going to make a quick. We talked about the 4th of July, and I hope you all had a wonderful 4th of July, and all of us, I think, pretty tired of this. Hopefully you did not go to large events. If you did, or in a situation like you went somewhere to have a barbecue and there's a few people there you didn't know, masks are off, I get it. I get why you want to do it. But you know that exposure is a greater risk. And what we want you to do, hopefully, is pull back now. You had some fun on the weekend. Let's pull back. Those 14 days after exposure are really helpful. If you're incubating the virus and spreading it unknowingly, you can reduce the amount of people you spread. So that is my request to you. The analogy I came up with is if you have a cookie, you ate the cookie, you know it's not on your diet, but you ate it anyways. It was really good. That doesn't mean you have to go and eat the whole box of cookies, okay? Just pace yourselves, guys. Next question.
Great analogy.
Here's one for Dr. Bacheldor. You know, the hot topic right now is the weather. So will the hot weather stop the outbreak of COVID-19?
We don't think so. We don't really have a lot of research on that right now, but as we're seeing down south, like in Florida, Texas, Louisiana, it's really hot down there like it is here. So we're seeing increasing cases down there. It's probably because things have been relaxed. As Annette said, you know, people have gotten out, they've kind of let their guard down. But the hot weather, we don't think is going to have an effect there. Much like the flu virus, when you get the flu, it seems to come in, you know, the temperature changes. But we're not certain with this virus what's going to happen. We still need some more research. There are some mutations of the virus. We're seeing that across and over in Europe and China. So we still need some more time to see what's going on. But I don't think the hot weather is going to make the virus go away.
You mentioned the mutation, and my understanding is that mutation appears to make the virus a little bit more contagious, but it's not clear whether it means the virus is more dangerous. So that's a real uncertainty right now with the virus, but it seems like it is changing enough to make it even more contagious, not less.
And it seems to be with the stickiness on the outside of the virus that causes it to stick to the cells and infect.
And I think we're seeing that, right? A couple of things we're actually seeing in trends is we're seeing that a lot more younger folks are getting it at a more rapid rate, but we're not seeing as many hospitalizations and we're not seeing as many deaths. Right?
And Dr. Bacheldor could probably speak to that. You're not seeing a big
Run
Younger people have less of the medical conditions. So we know that if you have more medical conditions, you know, the more medical conditions you have, chronic kidney disease, heart failure, heart disease, hypertension, immune suppressed states, that increases your mortality tremendously. I think somebody mentioned to me a few weeks ago, like if you're in the hospital and you have 5 of those conditions, your mortality rate almost approaches 100%. So it's really
pretty high.
You know, it's really important that, and the younger people don't have those conditions, so they seem to be less prone to being severely ill.
And there could be another component why we're not seeing more hospitalizations as we see the increase in cases, and that is because the hospitalizations and the real illness seems to lag behind the acute illness. There's generally, this is not a quick infection, you're over it quick. People get sick and they stay sick for weeks, and often the hospitalizations are occurring in the second, even the third week of the infectious process of the illness. So it may be, quite honestly, a little too early to tell. And with our younger cases, what we are seeing is it's spreading within families. So our younger cases are taking it home. Mom and dad are getting sick. Grandma and grandpa are getting sick.
Like you said, you know, you need to, if you're out in a group, you're potentially exposed, you need to keep away for a while.
And we are seeing that to a great degree.
All right, next question for Dr. Bacheldor. Can a person get the virus more than once?
We don't know. I don't think we have.
Can they hear? Does he need to repeat the question?
I don't know. The question was, can anyone get the virus more than once? We don't know that at this point in time. We don't have research to prove or disprove that. So, still to be determined.
All right.
Good
Dr.
answer.
Mercatante, why are we testing 150 people a day in the county? Is that based on demand or availability of tests?
The question is, why are we at 150 tests per day? We should probably be more if you look at statistically the number of tests you should be doing in a population to really get a good handle on where the virus is. But the availability of tests has been an issue, continues to be somewhat problematic. The other issue is that this is the demand. Like I mentioned earlier, we don't have a long waiting line of people who want to get tested that are waiting for another testing site. So part of it is the demand, part of it is the availability, and part of it is the economy, the resources that is available to us, and how much we can get out there.
So on the back end of that, or to tie into that, the testing that we're doing, does that include the testing that all of us healthcare facilities are doing?
Yes, it's all testing.
Procedures?
Yes.
So, yeah, and so we're doing that. So now as we're ramping up and starting to perform more elective procedures, we are testing more people prior to coming to the hospital to make sure that we're providing a safe environment for those patients and also our employees. So that number probably should even be a little higher and probably grow as time goes on.
I think it will. And of course, those numbers probably are just our county, which means they're not including the people who are going to other places. Like we have that Rite Aid site in Macomb County. I think a lot of people do that one. And so our numbers are, the amount of testing is an average that we look at to kind of judge how we're doing. And of course, the stability of the number of tests with the amount of positives is really important. So if we have a stable amount of tests that we're doing every day, but the percent positives are going up, that is a very telling thing. And so that's kind of how we look at that. But we will ramp up if we can as the need arises.
If I could just add a little more. At 160,000 people in the county, we would actually like to get that number somewhere in the realm of 300 to 400.
That's what we're thinking.
A day. And we are a little bit constrained by resources, both people resources and
lab
testing
resources.
kit resources. So we are working as hard as we can to get there, and it is still a nationwide, constrained resource issue. So we're still working hard to get there.
Okay.
All right, the next question is, when will flu shots be available?
The question is about flu shots and when they're available. We have no reason to expect flu shots will be delayed. They tend to be in people's offices about August, typically. We want to start vaccinating people as soon as they're available. You do not need to wait until October, November, when the flu season typically starts to get vaccinated. You get vaccinated as soon as it's available so that we can get to everybody in time.
Next question, will a COVID test be required to enter the community college?
Oh, the question is, do you want to answer that question or can you answer that question? Whether testing is going to be needed to enter a college
Or any other educational
facility.
Both Dr. Mercatante and I are on the education task force group, and to my knowledge, it is not required to enter this coming year for community college. So no, I don't believe a test is required to enter this coming year for community college.
But I think that they will still screen like everyone else.
They are going to do daily
our healthcare facilities,
yes,
you get your
sir.
temperature checked. You have to answer the questions before you go
Absolutely.
in. If you had a fever, been exposed,
Yes.
And if you get sick, they're strongly encouraging a test. And we want everybody to know if you get ill, even mildly ill, a test is a really great way of figuring out whether you can go back as soon as you feel better or whether you need to hold back for a little bit longer.
And speaking of that, if you do need a test, you can find testing centers and testing resources on the state of Michigan's coronavirus website. So just go on the state of Michigan's coronavirus website and you can find testing centers all over the state, not just here in St. Clair County.
Okay.
Next question for Dr. Bacheldor. What steps do you as a doctor take to stay healthy during the COVID-19 pandemic?
Well, that is I personally, or my staff, certainly we follow the CDC recommendations. I make sure that I'm healthy. I make sure that I exercise on a regular basis. I eat a healthy diet. All those things I tell my patients to do, I do. I wear my mask when I'm out. My wife and I went to Menards last night, and I was wearing our masks in the store, and I was really surprised because they have somebody there at the front that tells you, make sure you have your mask on. But when you get inside and walk around, not everybody has their mask on. So, it's really important that you wear your mask because it protects you as well as everybody else. Washing your hands frequently, using hand sanitizer. We have hand sanitizer in all our vehicles. When you come out, you make sure you sanitize your hands or wash your hands with soap and water, which is the best. If you use the hand sanitizer, make sure that it has greater than 60% alcohol in it. Keeping your social distance, as we have said before. If you're in a group, make sure that you stand back far enough. You're not real close to everybody. Before we used to shake hands and kiss and hug, and we don't do that anymore until such time we figure out this is gone.
We do air hugs.
Yeah. So, yep, those are the things that I do and we do and encourage our staffs to do. At our offices, we make sure that, we screen everybody that comes in. We have not only a few chairs that people can sit in. If it's busy, we have people wait outside. We have a screener at the door that checks temperatures and asks the screening questions to make sure that you're not ill. And we do the same thing in the hospital too. So. Those are all the
And
things
that does
we do.
remind me, it's a good time to discuss the fact if you go to a facility, a business, even a healthcare facility, and you don't believe that the proper safety measures are in place, and particularly if you work at a place like this and you don't know who to talk to, you can always contact us at the health department, 987-5300, and we'll take your complaint. But there is a statewide complaint line for MIOSHA, the Michigan, I don't know, what does MIOSHA stand for? Occupational Safety Health Organization. And that number is 855-SAFE, SAFE, C19. So SAFE C19. And if you call that number, you can also put a complaint in anonymously. So I urge you to do that, because sometimes businesses need a little bump to know that, yes, we really do care about being safe when we go out and do our business.
All right, next question. Does the health department offer antibody testing?
So the question is, does the health department offer antibody testing? And the answer to that is no, we do not currently. It does not currently have value in diagnosing COVID, which is currently our main issue. Now, when we get a positive antibody test, we don't consider that a confirmed case until we do further investigation, and we prefer any antibody test to have a follow-up PCR testing. But I do believe Dr. Bacheldor's hospital does some antibody testing. Could you talk about that?
We do have, and we just checked for the IgG, the antibody, but as Dr. Mercatante said, we don't know what it means. We don't know if once you have the antibody, if you're immune. It may tell us that you've been exposed previously. When it was, we don't know, and we can't tell from that. So, we do have it available and do offer it. We don't widely offer it, but if patients ask for it, we can do it.
And they go to your website. How would they access that?
So they would, they make an appointment, see us in the office, contact the office, and then, you'd have to come to the office, get your blood drawn, and we send it to the lab at the system down at St. John Hospital.
Okay.
Yeah.
All right, next question. What will be required for children to go back to school in the fall?
So that really is going to be the same answer as the community college. There's going to be a daily screening when they enter the school. There's potentially, if they ride the bus, there's going to be a screening before they get on the bus where they're going to take a temperature reading. They're going to ask them a series of questions. How do they feel? Do they have an upset stomach? Things like that. But they're not going to be required to take a COVID PCR test or a swab test, anything like that. It's just simply going to be a health screening test before they enter the school, and that's going to be a daily check.
One of the probably the more important things that people aren't going to want to hear, but I feel very strongly that especially if we stay in phase 4 and we're not completely resolved with all those, which I can almost guarantee you this is not going to be gone in September, children and staff across the board are going to have to wear masks to go to school.
Grades 6 through 12.
But even the younger kids
Agreed.
are going to be encouraged to wear masks because it makes a difference. And as long as it makes a difference and keeps our kids and our staff safer, we're going to want to do it. If a mask is medically unable, then other spatial things are going to have to be set up.
Right.
Kids will have to be separated. Face shields can be substituted, but they are not a substitute for a mask. So if you are only able to use a face shield and you were in fact exposed to a positive case, we would treat you as though you had no mask on as far as evaluating your risk of exposure. So this is something I want all of you guys to think about. And if you have kids getting ready to go to school, start getting them ready. Masks are not easy, but you can acclimate to masks just like everything else. We acclimate to wearing shoes in our culture. At first, if you don't ever wear shoes, you put a pair of shoes on. But if you wear a little bit every day, you break the shoe and you get used to it. There are different styles and materials for masks that some might be easier for others. And just start using that mask with yourself and your kids. Wear them progressively a little longer. Wear them inside and outside. And I think you'll find that it's a lot more doable than it may seem, because I do believe that mask wearing is going to be a very important component of getting our kids in school.
I think it's gonna be a challenge because I'm just, as we're talking, I'm thinking back to seeing pictures of bells ringing and kids coming into halls, and you see halls flooded with kids.
That's not going to happen
it's
either,
gonna be-
probably.
yeah, there's going to be a lot of planning that goes into before that first.
But
day
don't
starts.
forget, children all over the world have gone back to school wearing masks. It can be done, and I know it's difficult. I agree with you; it's going to be difficult, but we know it can be done because it is being done all over the world, and so there's no reason that we can't do it either.
That is probably going to be our biggest challenge in the school year for 2021 is returning our children back to school with wearing masks. But
And keeping them back in school so that we don't have these large outbreaks where we got to shut the school back down.
Yeah.
So that's going to be the key. I mean, if we have large outbreaks in the school, the only choice we're going to have is to shut the school back down. So if we want them to go back and stay in school, it's going to be this kind of stuff.
But rest assured, we are working hard on that
Yeah.
right now with all of the area superintendents and RISA and all of the private schools to get the right answers to make sure that we get your children safely to and from school daily. So,
Your educators are working tirelessly
working
on this.
tirelessly, I
Can
promise.
tell you that. Next question.
All right, why are some testing facilities still requiring doctor script before testing?
Lee, do you want to answer that? Why we require doctor scripts?
That is a great question, and I don't really have a great answer for it, unfortunately.
All right.
We do require that. We probably need to get beyond that for payment purposes for insurance companies.
It's
we have to have a
required.
doctor's script,
You do.
unfortunately. So to get it paid by the insurance company, you have to have a doctor's prescription.
Right.
We probably need to figure out a way to get around that and talk to the insurance companies, and so we get more people tested, and it's easier for people to get tested.
Because even here, even though you don't need a doctor's order to get tested here at the health department, they have me. Okay, so it gets sent in under
have one order.
my medical. Yeah. So, but there is another component to think about this. Testing randomly, anonymously is great, but if you're feeling ill, there is a value to being seen by a healthcare provider. Now, COVID, let's face it, COVID is still relatively rare, and you could be having an asthma attack, you could be having a number of conditions that really do need medical assistance. So I want to encourage people that, just getting a simple COVID test and it's negative, number one, shouldn't reassure you because the next day you could have a positive COVID test. But if you're feeling ill, please seek medical care because there's millions of other things that you could be suffering from that do need to be diagnosed.
I had a patient, the family called and they wanted him to get a COVID test. They wanted to take him somewhere to just get a COVID test done. And I said, listen to symptoms, probably needs to be seen. Turned out the patient was really ill, had bacteria in his bloodstream from another source, and really did not have coronavirus.
But was sick.
Ill, sick, and needed to be in the hospital, so needed to be seen. So, yeah.
And that could have been a
You need to
disaster.
be evaluated to see if, the test is appropriate. You can still do the test, but then there are other things that can
Yeah.
happen.
So don't ignore your body. Thank you.
Next question, how long does it take to get test results?
The question is about how long it takes to get test results. So, Lee, at
Depends
River
on where
District?
you get it done at, I think.
Yes.
Yeah,
How
so-
long does it take at your facility?
So at our facility, we get results back within 24 hours.
Yeah.
We have rapid tests that we do sometimes for patients that get admitted to the hospital. We have another piece of equipment that we bought at St. John Hospital Medical Center, which is a Roche test, which does 800 and some tests a day. They run it every day, and we get test results back the next day. So in 24 hours, you get the results back.
And I would say, like Huron Medical Center and McLaren Medical, I have very similar situations. Us, on the other hand, have to rely on the state lab, Bureau of Labs, as well as some other labs that we don't have access to that the hospitals do, and it is taking us up to a week to get results, sometimes even a little longer. So we're working on fixing that. There is a discrepancy clearly between those who have access to healthcare systems and insurance and access to the type of testing you provide and testing, for instance, that we have where there is no barriers, where you don't need insurance, no payments, and we're working on that. But there can be some big lags in test results, for sure. And if you need it quickly, my recommendation is to go to one of our hospital systems and get it done there. Yes.
4 minutes.
4 minutes.
So
Oh, wow.
one question, and this one is for Justin. Why did we suddenly shift on the Be Ready page, promoting to the general public to wear masks or face coverings?
That's an easy answer. So and I don't think it was a sudden shift. My answer to that is it's very obvious that wearing a mask can change up to 70% of this whole thing, making it much easier to stop coronavirus transmitting from person to person through aerosol, right? So every time we breathe, every time we cough, every time we do anything orally, if you're infected, you're pushing it out, and you're trying to stop that or contain that with the mask, so that anybody standing within your 6 to 21 foot distance, you're not giving it to them. You're not sharing the goodness with them, right? So that's
But at the beginning, we thought we knew there were not enough masks for our healthcare providers. And that's a really important piece.
correct.
We do know more information, but at the beginning of this, we were terrified that our healthcare providers would not have the access to the proper enough
is absolutely
PPE.
true.
And that was another reason why officially people were told not to wear masks, because we didn't want it to be shifted to the away from our highest need. So that's an important factor that people forget.
Yeah.
Not only do we know more, but there was a different allocation of resources going on back in March than there is now.
February, March, April, and the first part of May, we struggled immensely with personal protective equipment for our doctors, nurses, first responders. We struggled so hard just to outfit them with the proper PPE and continue to outfit them. We are in a much different place now. And so,
Let's
Dr.
get one more
Mercantante's
question in.
correct.
Yeah.
And changing things has been kind of the whole mantra of this
Yeah.
disease, because we've never seen this
Constantly.
before.
Yeah.
This is the experience. The knowledge has changed from day to day, sometimes hour to hour. So there are changes, and our knowledge base changed dramatically throughout the whole course of the last 3 months.
Yeah, you think most infectious diseases, we've had decades and decades of experience. We've had less than 6 months with this thing. So it's been hard.
And we've gotten so smart. And we're going to get smarter.
We're gonna wrap up and do final comments, but we want to do this question because this kind of came up today in the governor's
Okay.
That looks
live.
All right, is it possible that some phase 4 strong recommendations may become required? Would that happen before considering going to phase 3?
So the question is about these phases, and in each phase, of course, there's different restrictions or release of, the governor's decisions are often not shared with local public health. They're shared with you at the same time they're shared with us. I can tell you, though, that the governor is working really hard and taking a lot of advice about which way to go with information, with the data going in the wrong direction. It's possible she'll try and pull back, but I really can't predict for sure. I'm hoping that voluntary compliance will do the job. Do you have anything else to say about that?
I don't. Go ahead.
So I agree wholeheartedly with that. It wouldn't be worth the time or effort to try and wonder what the governor is going to do. It would be more worth your time to just
Do the right thing.
do the right thing, do whatever you can do to protect yourself, protect your family, protect your friends. Wear your mask, keep the distance, and enjoy your summer while doing so. But we're gonna get through the summer. We're gonna get through the fall. We're gonna get our kids back to school, and then we'll just keep working at this thing, chipping away as much as possible as we get closer to 2021. And I think that's all we can do. Doc?
I think the greatest point you had in the pearl was, the cookie analogy with, if you're in a group and you're exposed and you didn't practice social distancing, didn't wear your mask, and potentially got exposed, make sure you take the time to stay away for another 2 weeks, sequester yourself, and don't spread it to anybody else. Make sure
Stay
you wear
away
your
from your
mask.
grandma.
Yeah. Stay away from grandma, grandpa, mom, and dad if you're a young person.
Yeah.
Great advice.
Yeah. Wrapping up? Okay, we need to wrap up. We all say a few comments. All I'm going to say is stay strong. We can do this. It's a rah-rah. We can do this. We're showing on the map that we have the opportunity to hold this down, and this is our moment to hold this down. If this gets out of control, it's really hard to put the genie back in the bottle. So let's keep working on it and do the right thing. Lee?
And thank you for the opportunity to join you two today. This has been great. It's been fun. I can say that I get data from Ascension Health, which is our parent organization across the state. We have hospitals in Kalamazoo, St. Mary's up in Saginaw, Standish, throughout southeast Detroit, and we have seen a significant flattening of our case rate. So we're going in the right direction.
Mm-hmm.
St. Clair County is doing as good a job as any county in the state with, as you saw in the data, with our curve. We need to continue on this trend, and that starts and ends with everybody watching this and every single person, the 160,000 in our community. So we'll just keep doing what we're doing. We'll work hard at it, and we'll see everybody next week. Have a great week. It's going to be a
Thanks for
warm
joining
weekend,
us.
and thank you so much.